The test is actual multiple components. So where the virus lives is typically can be in your nose, your throat, your oral cavity, and then sometimes in the lungs. So the easiest places that are accessible to us are in the nose. So when a patient needs to go for testing, they will go to either a drive-up site or a collection clinic where the collection will be done. In that process, a nurse or a care provider will use the swab, which is just kind of like a Q-tip, that they will place the swab up in your nose and move it around to make sure that any of the virus that is living there will get on the swab so that then we can take it back for testing. So the testing doesn't get done right there. The collection process is the piece that happens when you're in contact with one of our caregivers. So if many people have had a swab for strep throat or a test for the flu, so it's very similar to those types of tests in terms of the collection process that an individual would experience. So once the swab is put into the liquid, the virus will come off of that swab and into the liquid. So the liquid is actually the component that we test. So what we need to do with that is we take the liquid that has the virus in it, and we need to access the viral genetic material that's in there. So there are some steps that can either heat it or use some other machines and equipment that will kind of tease out or select out that genetic material. Then we put it onto an instrument that has different components or compounds in there that will match up and pair up directly with just the coronavirus 19 genetic material. They won't match up with flu, they won't match up with strep throat. It really is targeted just to that coronavirus material. And so if that's present, it gives a signal that the machines can read, the machines can detect, that will let us know that the coronavirus was or wasn't there. So if we get that signal, we can say, yes, you have coronavirus disease, or no, there's nothing in there, and so that's not the cause of your symptoms.